Oh yeah. Alright guys, you made it. Hey postural neck muscles. Oh, posterior. Ha! This is a great way to start the video. Okay, so deep and deeper. Hey so this is gonna be the deepest muscles over here. We're just going to jump right in kind of where we left off. We're looking at spine curvatures. I can actually kind of help you out there when it comes to some of these spine curves and what causes them besides, just disease. Some of it is lifestyle, but a lot of it is osteoporosis. But we talked about the vertebrae. The vertebrae is. Did anybody ever play with like one of those wooden snakes that could bend and go all over the hoopity doo? You know what I'm saying? So it is little blocks of wood, but together they have these little gaps and they can slither around. I don't. This is a headband. Let's just put it on. Yeah, my little girl's headband. I feel very secure. Oh, and it's Barbie Day, so I'm wearing the pink. You all right? So I probably look ridiculous. Let's do it. But that's the way the spine works, guys. The spine is a stack of like those little blocks of wood, and with these little gaps in between, we get a lot of motion out of these semi-mobile. They're semi-mobile joints, these cartilaginous joints that we talked about of the intervertebral discs. Okay, somebody says, "Oh, I herniated a disc in my back lifting on that tractor." So I live in Oklahoma, so that's what we get all the time. I blew out a disc. I've got a ruptured disc. I've got a herniated disc. And so the herniated disc, what they're talking about, and if you know what a hernia is, it is a bulge or protrusion. So when this annulus fibrosis is, yeah, there it is. There's a herniated disc. So you're looking at some of that nucleus pulposus is coming out and it's pushing on the GD spinal cord. Incredibly painful if you've never had the pleasure. It is very I've had one. It's awful, but it blows through. So this is sort of, I should say, like a rubber gasket around like a softer type material. And this annulus fibrosis, and it says fibrosis because it's fibrous material, it's very tough and rubbery. And man, it takes a lot of force, and you just think of sandwiching force. Bam! Like enough to crush a can or whatever. And here's another headband. Okay, but if you see this right here, and we're gonna smush it down, and just it blows out. And it actually kind of happens in a flex position. So if I'm bending over, this is how I did mine, but I bent over and I picked something up like a suitcase and turned to walk this way, and it was that bending over flex position. Okay, and there's a lot of force on something just fell. There was a lot of force on the front side of this guy, which would actually be, I'm pointing at the TV, I'm being ridiculous, but on the front side, okay, you're bent over, you're pushing hard on the front side of that disc when you're leaning forward. Now this is why they say keep a straight back and bend your knees when you're lifting, because if you bend over like this, you're already smushing on the front side of this disc, and then you go to pick up something heavy, you lifters doing your deadlifts, and you look like a camel, trying to deadlift a bunch of weight, You're asking for it. You're asking the good Lord Almighty to blow out a disc because you are pushing on the front of that, putting so much force on the front that there's nowhere else for it to go except backwards. Okay, and it will eventually, over time, weaken. That's what happened to mine. And boom, you're done, dude. When this happened to me, my right leg, completely locked up, and I fell down twitching like a squirrel that got electrocuted by a power line. That's exactly what it was like. So, looked like a twitching squirrel out there, but it was horrible. And I was able to rehab it, but I tore through the MRI. I tore the annulus fibrosis. I did have some bulging, so there's bulging disc, herniated disc, and ruptured disc. Okay, so this actually says disc herniation, but it looks like ruptured disc because the nucleus pulposus right here, that inner jelly material, has been displaced outside of the annulus fibrosis with a complete tear. So that would be more ruptured disc territory than just herniated. Okay, and there you can see what that looks like from a side view or sagittal view. Okay. But anyways, all that to say, we're supposed to talk about muscles. Okay. And we talked about the neck. I wanted to show you guys this one here. This is some kyphosis right there on purpose, looking at the phone. And, from our society, I could blow up this picture. That would be really great, but kind of can't. It talks about tightening of the chest muscles and having weak, deep neck flexors. Okay, stretched and weakened the trapezius serratus anterior. Tight upper traps and levator. I don't know about tight. I guess you could say tight, but it's been stretched and weakened. But what's actually tight is the pectorals. That's 100% true. Super tight, because you just think about what it takes to put yourself in that position. Okay, that kyphotic posture, and over time, these muscles will lengthen and weaken, and these muscles will shorten and tighten, and then you're stuck that way until you can stretch it back out, strengthen the muscles between your shoulder blades and your neck. You could be very much stuck that way. So there's a little caveat there. I love talking about the spine. But we're going to talk about these muscles here. Sternocleidomastoid. Okay? Now, don't panic. Please. Sternocleidomastoid, one of my favorite muscles. Got a long name here. There it is. And there it is, attaching right behind the ear, posterior to the ear on the skull. And I don't want to take too much time explaining all these guys, but I do want to just give you a Mickey. What have you done? Okay. Sternum. Sterno. Okay? Sternum. Cleido. Could you imagine where Cleido comes from? Okay? Sternum, clavicle, sternocleido, mastoid. And it's the mastoid process of the skull, which if I could find me a skull, you would see it right there at the base of the skull. There's a little bump. Mastoid process. Now a process is a point or a protrusion or projection like that off of the skull. So this little bump right here is the mastoid. The mastoid. So that is where sternocleidomastoid attaches. Okay? So we're going all the way back down, and I hope I don't have to do this with all these guys, but sternocleidomastoid, great muscle, you'll see it if you just turn your head. You turn your head to the side, you'll see it pop up. Okay, maybe on the same side, because turn, there it is. Okay, sternocleidomastoid right here. And that's what it does. It turns the head. Okay, it actually turns the head to the same side. Now, it's kind of interesting. So, I gotta move on though. I gotta move on. Semispinalis capitis, okay? Don't panic. Semispinalis capitis. What is capitis? Cap, head, muscle. Head muscle. That's what capitis means. Capitis means head muscle or skull muscle. So it is telling you, and so spinalis, I can't remember what spinalis means. I think it means thin. Somebody help me out in the chat. But spinalis, semi-thin head muscle. Okay, and it's next to the spine here, or the nuchal line, I believe is what this is. So this guy is flat, and it might mean flat, spinalis. I know splenius means flat. It's like bandage. So us, okay? Us means shape, like, so it's like a bandage-shaped capitis skull muscle. So it attaches to the skull, and it's bandage-shaped, splenius. A bandage-shaped skull muscle. That's what that means. So splenius capitis is big, flat, and wide, like a bandage. So really, man, like, you get to know some of these terms, it's not so bad, and just knowing their orientation. Levator scapulae, okay? Levator is to elevate, or that's like it's telling you what it does. It's levator scapulae. I lift the scapula. The scapula is your shoulder blade. Lift the shoulder blade muscle. That's what that says. Levator scapulae. Okay? And it actually attaches to the scapula, the shoulder blade. You can see it right here. See, there's a superior angle, I believe, is what that's called, of the scapula. And there it is attaching. Whoop, going straight up towards the skull. Okay? Levator scapulae, guys. There it is. Bang! Great little muscle. I've strained that one before. Splenius cervicis. Okay, cervicis. Cervical vertebrae muscle. It's a bandage-shaped cervical vertebrae muscle right there. Splenius cervicis, splenius capitis, kind of going in the same direction. Okay, one's smaller, one's bigger. There you go. Now, these little guys here will assist. So you didn't think that you'd turn your head all on your own without any help, did you? The atlas and axis, which we talked about up here, atlas and axis actually have several muscles that attach to them, assisting with this twisting motion. And they're small muscles. They're attached to C1 and C2, and yeah, they help turn your head. Okay, you got big muscles to do it, but these are the real rotators, like the guys that are responsible for that. The obliquus capitis inferior. Inferior means it's below. We talked about superior and inferior. Now obliquus capitis superior. This one's above. This one's below. Superior, inferior. Now oblique, I believe, is just that it's going at an angle. It's an oblique, angular shaped skull capitis muscle above and one below. These are those two. And then we've got rectus capitis posterior major and minor. Major would be the bigger one and the minor would be the smaller one. Okay, major and minor. Rectus capitis posterior minor, rectus capitis posterior major. Okay, posterior meaning it's on the back of the skull. Okay, and rectus, I believe, is usually a muscle with either straight lines or assists with extension. I can't remember. Somebody help me. Semispinalis capitis. This is a muscle just underneath. It's showing you the cutaway, so it's deep to splenius capitis. Semispinalis capitis, which we've showed up here, but this is where it is. It runs all the way down and underneath, deep to splenius capitis. And a scalene posterior. Look at the scalene. They're so cute, little tiny muscles. The scalene muscles often attached to the first rib. Okay, you can feel them right there, and they hurt really bad when you push on them. But there's a posterior, I believe there's 3 or 4 of them. I haven't seen them in a long time, guys, but if you're having, just so you know, if you're having pain around the collarbone or having shoulder issues, sometimes they will do a deep tissue massage on the scalene muscles to help relieve tension on the collarbone or the first rib. Very common, and it is spicy. Alright, so we're moving on to postural muscles. I gotta go faster than this. Serratus posterior superior above. Serratus is like a serrated blade, so it has a serrated edge. It's like the like a serrated knife. So it's serratus, okay. Posterior superior, so it's on the back side and it's above. Serratus posterior inferior below. And it's a collection of muscles that makes it into like one muscle. It's, you know, there it is right there, and you can kind of see in real life it really looks more like one muscle, but it's a grouping and it's very fibrous, and yeah, it's this jagged edge here that you see of the muscle tissue. It's where it gets its name of serratus, the samurai sword in your back. Alright, so long. Now, what does this one mean, you think? Longissimus capitis. You're right, it's the long shaped muscle of the head. It's long shaped, long looking skull muscle, longissimus capitis. And splenius capitis is getting another shout out right here. The bandage shaped head muscle. Straight external intercostal. So it's just showing you what these intercostal muscles are. Costalis. Costalis means rib muscle. External. You know, it could say superficial, but it's saying external is kind of what the muscles do. Between rib muscles. The external between rib muscles. That's what that means. Okay. Splenius cervicis is getting another shout out right here. And the erector spinae. So the erector spinae are your big erector, causing erect spine, extension of the spine. That's what these muscles do. Iliocostalis. Okay, ilio is hip, costalis is rib, so hip rib muscle group. It goes from the hip and it attaches to the ribs, iliocostalis. Okay, you see it right there. and it's attaching to these ribs, and it goes down here and it attaches to the hip. It's deep to that um, longissimus group and the spinalis group, so you're not really seeing it, but it is attaching to the top of the rib, okay, or the top of the hip. Jeez, holy crap! All right. External oblique, internal oblique is just showing you where those are, and they do, your obliques do wrap around all the way to the spine, pretty much. So there you go, like little corset. We've got longissimus group. Now, longissimus actually does run all the way down to, like, say, the sacrum, and then goes all the way up to the back of the head. But somewhere along the way, it gets called longissimus capitis, okay? Right before it attaches to the skull. And down here, it's the just longissimus, okay? The long looking muscle, okay? And they are groups of muscles. Spinalis, okay, this is not doing a really great job with spinalis, but it is right along the spine ish. That's why it's called spinalis. Spine muscle group, spinalis, okay? Transverso spinalis muscles. So these are little tiny muscles that are responsible for extension, flexion, and a rotation of the spine, just like you have these here around axis and atlas, and you see how much bigger these guys are, because guess what? They've got to turn the whole head. They have more specificity. These guys just have to turn the one above them, if that makes any sense. And they make a chain all the way down the spine. You're going to find these muscles in a chain. And that's when, big power lifters talk about building up this posterior chain. This is the chain. This is the chain of muscles that they're talking about, hopefully. There's a better picture. Hold on, that's not spinalis. It's showing you multifidus and semispinalis thoracis, which semispinalis thoracis, transverso spinalis muscles. Yeah, so multifidus is longer, it's bigger, it's in the lumbar region, okay? And then these are long, like kind of long, thin ones that will attach at the ribs, okay? And these are semispinalis thoracis, like the thin spinal thoracic muscles, okay? Multifidus is, it's more like kind of pyramid shaped. It's shorter, it's fatter. This isn't a great picture. Semispinalis cervicis and semispinalis capitis getting another shout out for being transversospinalis muscles. There they are. And quadratus lumborum, one of my favorite muscles. Quadratus means so cube, quad, four-sided. Okay, quadratus, four-sided, square-shaped, lumborum, lumbar muscle. It attaches at the hip, and it's in the lumbar region, but it kind of attaches to the lowest ribs here. If you've ever had pain, and deep pain just above the hip, okay, from a muscle doing some workout, it's probably a quadratus lumborum, and this is a terrible picture, but it is a lot more square shaped. There's a lot of wind outside, and it sounds like Santa's on my roof. Not cool, because it's not Christmas. Krampus. That's scary. Now, let's focus. Alright, so Intertransversarius. Okay, this is a lateral flexion muscle, and it's in between transverse process muscle. Here's a transverse process here. These are obviously, they look like giraffes. Okay, you see the articulating cartilages, or where their articulations would be for ribs. And this is obviously in the thoracic spine. It's got a longer, thinner nose of the spine. Like the spinous process is longer and thinner. You've got these little articulations where the ribs should be. This is a thoracic spine. But in between transverse process muscle, that's what that means. Okay? Here's a transverse process meaning point. There's a muscle in between causing lateral flexion. And rototores, so cool. Rototores, it is both of these muscles. It's going to the nearest, from spinous process to nearest transverse process, and the one below that. Okay, so it's going to this one and that one. So it does both. Rototores, what do you think it does? Rotation muscle, thoracis. So at the thoracic level, I turn the thoracic spine muscle. That's basically what it's saying it is. Transverse process of the vertebrae right there. Interspinalis. So yeah, interspinalis, in between spine muscles. Okay? And there's two of them. Kind of one on each side. Alright. How much time have I wasted on all this? Probably a lot. That's cool. What time is it? Alright. Let's just go over these big baddies. Trapezius. Trapezoid shaped muscle. Deltoid. Okay, right here on the side of the shoulder. Teres minor. Teres major. Latissimus dorsi. Okay, dorsi, dorsal back. Latissimus is the flat-shaped, the big flat-shaped muscle on the back. That's what that means. There's your serratus posterior inferior, and they're not going to show us superior, are they? There's rhomboid major being the big one, rhomboid minor being the smaller one, and it's going to the scapula here and back to the spine there. There's a shout out for levator scapulae and at the superior angle of the scapula. And we're going to take deltoid away and take a good look at our rotator cuff muscles. There they are, guys. The supraspinatus, infraspinatus, teres minor. Okay, and if we were, teres major is not one, by the way. And if we were to go underneath the scapula, you would see subscapularis, which is a rotator cuff muscle. So, alright, there's another look at the same stuff. And there it is, subscapularis. Okay, so subscap, underneath the scapulus, the scapula. I made up a new word today. So supraspinatus, above spinatus, spine. This is what's called the spine of the scapula. Okay, it's this ridge right here. Infraspinatus, below the spine muscle, above the spine muscle. That's what those two words mean. Teres minor, okay, and there's subscapularis, underneath the scapula. Kind of looks like a clam, right? So, muscles of the posterior thigh, we're getting a list here of gluteus maximus, medius, and minimus. Maximus, biggest, medius, middle, minimus, smallest. Okay. And piriformis, these laterally rotate the hip and thigh. Superior gemellus, inferior gemellus, obturator internus. Guess what that does? And quadratus, what does that mean? Femoris. Okay. So we've already peeled back glute max because it is like the covering that goes over all this. So glute max is right there, it's been cut. Glute med, gluteus medius, has been cut as well. So we can see gluteus minimus. There it is. And then piriformis is right below there. Piriformis means the pair forma. Pira, pair, forma, form of the pear-shaped muscle. Pear-shaped muscle, that's what that means. Just below, inferior to gluteus minimus, piriformis. Very important muscle, guys. And I'll explain that in another video. But superior gemellus, right there, the one above. Obturator internus is going to come across, and obturator internus, guess what it does? Okay, and if you see this orientation, you can kind of tell it is going to rotate inward. It's the rotator inwarder muscle. That's what obturator internus means. Inferior gemellus right there. Okay, and we're gonna see ischial tuberosity. That's just a landmark where those are attaching. Biceps femoris. Okay, these are the hamstrings. The long head, and adductor magnus is going to make his appearance right there, which is a bad mamma jamma. Adductor magnus, it's so cool. It's a cool muscle. It's one of my faves. Semitendinosus, another hamstring. The IT band, iliotibial band, getting a shout out here. Okay, now we're getting into nervous system structure and these, the spinal cord anatomy, which I wasn't ready to take you guys into. This is kind of gross overview. Okay, why not? White matter, gray matter. Okay, it's obviously white. This is darker in color. This would be the gray matter. Okay. There's a posterior horn, a lateral horn, anterior horn, and the gray commissure. Okay, that is this one little spot right in the middle of this H, the horns, okay, posterior horn, and is their lateral horn is kind of just a little protrusion, and then anterior horn. So they're calling this the lateral horn. And the gray commissure, right in the middle. Center of the bullseye, guys. The white matter, there's a white commissure. It's showing it just below there on the anterior side. Okay, well, not seeing it very well. Anterior funiculus, okay. Lateral funiculus, posterior funiculus. Now the funiculi, it's this ridge bump situation. Bump, 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 bump. Anyway, there you go. It's just showing the spinal cord through the different levels. Okay, and we in physical therapy and the medical field, you're going to really pay attention to the spinal cord, at what level it was injured, and it really impacts the function of the patient pretty much long term, where their level of injury is. When they say the level of injury to the spinal cord, what level, they're going to say something like C7, C8, T1, T2, and that really impacts where the injury was, impacts the level of function a lot of times, not always, that the patient will have, unfortunately. Now, I talked about the spinal canal and how it has these different layers, these different sheaths, and these are the different sheaths that are being portrayed here. So this is duromater, and what, arachnoid mater, okay? What is this? The subdural space, okay? You ever heard of an epidural? Yeah, have you? An epidural, usually it occurs in the subdural space between dura mater and arachnoid mater. I believe. Now, I've never done one, so. But they're basically inserting a needle right in there. Sorry, that might be loud. And they're going to deliver some medication just below the dura. Okay, dura mater. Mater means mother. Mater, mother. The dura, the hard mother. Okay, durable mom. All right, and then arachnoid mater. You're right. It means spider mom. That's literally what it means. It's web-like. And then there's the pia mater, which means gentle mom. Aw. Those are the three layers of protection that the spinal cord has. Okay, I don't want to go into any more depth than that. That's the same picture. Yeah, I don't feel like it, so I don't want to go into this. I'll let you take a screenshot of that if you so desire. You can pause the video. Don't feel like getting into all this stuff quite yet. It's really not that important to me, but I'm gonna move on. And okay, so this is just giving you an idea of how the spinal cord is going to affect different musculature. Okay, and where some of these nerves are going to go, like the rami communicantes. Okay, sympathetic trunk ganglion, sympathetic nervous system. Okay, ganglion usually is like, a bulb, and there is a chain from the sympathetic trunk ganglion. There's a chain of these that run down the anterior side of the spinal cord, or on each side of the spinal cord. These are called ramus, a anterior ramus or a posterior ramus. Okay, posterior root ganglion. This is the bulge here in the posterior root, and then it turns into anterior ramus, posterior root ganglion, posterior ramus, and then it just kind of, there it goes, deep back muscles. Those muscles going straight from this posterior root. Okay, sounds cool to me. Maybe that's good. What do you guys think? Did I bore you to tears? Are you still there? This is Major Tom to ground control.